Good afternoon, everyone, and thank you so much for joining us for our READI Research Policy Impact Series. But before we begin, we'd like to share a little bit about the CTSC. The Clinical and Translational Science Collaborative of Northern Ohio is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, Metro Health, University Hospitals, and the Lewis Stokes Veterans Administration Medical Center, Northeast Ohio Medical University, and the University of Toledo. We aspire to be a catalyst for high-quality clinical and translational science and transformative research to positively impact the health of those in Northern Ohio and beyond. Today, we have the fortunate opportunity to have expertise from Research America. We have Eleanor, Ellie, she's a Senior Vice President of Policy and Advocacy, and Samantha Miller, Sam, Associate Director of Policy and Advocacy. And without further ado, I'm going to let them have the floor, and we are in store for, we have just a treat. So everyone get ready.
Thank you so much. Sam, I'll just go ahead and get started if you wouldn't mind sharing our slides. But I would like to say that prior to working for Research America for about a decade, I was Senator Sherrod Brown's legislative director for 11 years. Also worked for him on both the House and Senate side. And I am an Ohioan in my heart, even though I'm a New Yorker in terms of my actual background. So the purpose of today's discussion is actually to talk about the use of non-peer-reviewed research papers and materials like that of Kaiser Family Foundation. You know, they have reports, or CDC has reports. So how do you make use of that data in our case, in advocacy and education? But we're gonna kind of wrap that into a bit of a mini kind of advocacy workshop. We thought that might be the best way to really kind of show how we use this information in our day-to-day work, and hopefully you will as advocates, as research advocates. So about Research America in 30 seconds flat, we are an organizational alliance of about 300 members. We cross the research and development ecosystem in the health arena. So patient organizations, scientific societies, research universities like Case Western, philanthropies. We do have industry members, mostly pharmaceutical and medical device. And I am certainly forgetting categories. So our goal really is to cover the whole ecosystem, soup to nuts, and to gain insights from each sector in advocacy for maximizing federal funding to propel medical and public health progress. So funding for NIH, National Science Foundation, CDC, FDA, Agency for Healthcare Research and Quality, BARDA, the biomed. I'm not going to get this. I'm not going to get the acronym right, but I think it's the Biomedical Research and Development Authority. Sorry, I should know that. And anyway, what we try to do is leverage resources like the ones we're going to be talking about today, and engage advocates in making the case that our nation's science and technology enterprise is crucially important, and medical progress and public health progress are societally so significant, and we can be doing a lot more to advance both. So if you would move to the next slide. So very quickly, why weigh in? And right now I'm going to channel this notion of how you use research reports. So if you think about it, every day, 200 Americans lose their lives to fentanyl. There are 6.5 million individuals in this country living with Alzheimer's. That's more than the populations of New Hampshire and Iowa combined, right? Youth, mental illness, it is spiking in this country, robbing youth of their youth. We need faster medical and public health progress. So I chose those data specifically because in Congress, those three issues are receiving a lot of deserved attention. So that was just, a prelim show of how we use this data. But I do believe, and I've seen it, that advocacy making use of data like that and stories can change the course of history. Think about HIV/AIDS. It was informed and engaged advocates that convinced the Food and Drug Administration to accelerate the approval of drugs that save lives, and NIH to get on the horse and start working with industry to develop drugs to turn HIV/AIDS into a manageable, generally chronic illness. We're not done yet, but your voice, our voices together can change the course of history. And that's why we're here. And I think I am now turning it over to Sam.
Yes, thank you so much, Ellie, and thank you all for being with us today and for having us. I'm very much looking forward to being with you. So as we discuss informing public policy through data today, I'm going to give an overview of one of the key ways that Research America utilizes data in our advocacy work, and that's through our public opinion polling. Here we have a quote from President Abraham Lincoln: "Public sentiment is everything. With public sentiment, nothing can fail. Without it, nothing can succeed." And that's really the foundation of the public opinion work that we do at Research America. And the work of an advocate ultimately lies in bettering the public good. And without the input of the public, we can't really fully realize what that direction looks like and what that sentiment means. So at Research America, we've been commissioning public opinion surveys for 32 years in a variety of forums, from national to state to issue-specific surveys. Our online surveys are conducted online with a sample size of between 1,000 and 2,000 adults, and the data is weighted in 2 stages to ensure accurate representation of the US adult population. And for many of our surveys, we oversample minority populations as well. Today, I'm going to be walking us through some of the results from our annual January Omnibus survey. This is an example of a survey that we have been commissioning for more than 3 decades. And the longevity of this survey has provided us a historical accounting of the cultural and societal shifts that we've seen over the course of those decades, and continues to inform how we're moving forward and providing an understanding of where we're coming from at the same time. So our surveys really function as a communication tool for us. A key tenet of public policy work is effective communication, and the type of surveys that we commission at Research America serve the purpose of providing a concrete communication tool that can be utilized in a variety of settings, from policymakers to other advocates and within the community to the public writ large. And that's for a number of reasons. That's because polls tell us where the public is. When we have a sense of the issues that are top of mind for the community, and therefore are most likely directly affecting their everyday lives, we're provided a litmus for policymakers and the legislative work that could and should be done to best serve the public. Polls are also a snapshot in time. They tell us where we are at any given moment. As I mentioned, we've been commissioning surveys for over 30 years. And over the course of those 30 years, we've asked a lot of the same questions year in and year out. And over the course of that time, opinions have changed. The public has felt differently. Ellie mentioned HIV/AIDS advocacy at the top of the hour. As you can imagine, 25 years ago, that was the #1 health issue that was being reported by the public as of concern. 25 years later, in 2021, the #1 issue was COVID. So it really gives us a good sense of where the public is standing at any time and helps us track how progress is being made and what that progress looks like. Dissemination is also key. It's important to share this data widely so that informed decisions can be made not only with data that is driven scientifically, but is reflective of how the public is feeling as well. And I will say, as a caveat, there are limitations to this type of polling on complex topics and issues. While survey data is important, it doesn't serve to provide indicators for causal relationships, but it's rather a litmus for what is important to the public and the best ways that we can use existing and emerging evidence to inform policy outcomes and the advocacy that is supporting those outcomes. So with that, I'm going to walk us through some of the results of our 2024 Omnibus survey. As we're moving through these results, I'll take a moment to shed some light on why these types of results are critical to our advocacy work and how they can be utilized to inform public policy outcomes. So here we have our first result, which is showing strong bipartisan support for basic research. Respondents were asked, do you agree or disagree with the following statement? Even if it brings no immediate benefits, basic scientific research that advances the frontiers of knowledge is necessary and should be supported by the federal government. And we can see here, there is strong support across party lines. 95% of Democrats and 85% of Republicans said they strongly or somewhat agree with that sentiment. And that is an excellent data point to be sharing with policymakers that shows the American public is invested in this kind of, in basic research and in the scientific enterprise. And it's something that if the American public is invested in, our representatives should also be invested in. Similarly, strong bipartisan support for greater investment of taxpayer dollars in science and technology in the US. 75% of Democrats and 54% of Republicans believed that Congress should be investing more taxpayer dollars to advance science and technology in the US. So not only is there a general sentiment amongst the public that investment, that supporting the scientific enterprise is important, but also they're willing to invest in that and believe that Congress should be investing in that. As we are in an election year, we did ask in our omnibus survey about candidates and their platforms, and 84% believed that it was important for their candidates in 2024 to be promoting faster medical progress. So not only is the general sentiment that this is an important issue for legislators writ large, it's also an issue that voters are going to the booth and thinking about. It's something that they want their candidates to believe in, and it's something that they will be paying attention to when they're ticking off their ballots. And again, nearly 69% of Americans believed that candidates should be in favor of spending more taxpayer dollars on medical and health research. And they're more likely to support candidates who are in favor of increased spending for medical and health research. So just like the first two results, we're seeing trends that the American public believes that not only those who are already elected, but those who they are vetting to sit in office should be supporting the investment of this critical enterprise that shapes so much of the outcomes of our society. And then finally, and this is a super impactful one, I think, nearly 9 in 10 believe that it's important for elected officials and candidates to listen to advice from scientists. I think this speaks directly to the fact that the American public not only understands that science and technology and the research ecosystem is an important ecosystem and should be paid attention to in Congress, but they also believe that Congress should be informed by those who know the most about science and technology, that scientists are the experts, and that those are the people that we should be listening to. And they value when those people are sharing the long career knowledge that they have that can really make a difference in their everyday lives and their lived experiences.
You know, Sam, let me interrupt to say, I think one of the reasons that's a really important data point is because when you think about science trust, you often think about trust in scientists. But what we've heard on the Hill and what survey results reinforce is that there was distrust in leadership that really intensified during COVID because of differences in ideology and differences in reacting to uncertainty and those kind of things. But trust in your neighbor who is a scientist doesn't seem to have wavered one bit. And I think it's really important when folks try to get at the science trust debate to realize that they're, to really understand it. And I think that data point really helped us as we look at the issue of science trust.
Absolutely. Thank you for that, Ellie. So now I'd like to talk about how we use our public opinion data in our own advocacy work. And I think that's a critical part of our advocacy puzzle that we engage in every day. And one of those ways is in social media and in publications. So every survey that we commission, we publish a complimentary report that walks through the entirety of the survey, explains the process for getting the data, and then provides outcomes that can be found from the data itself. So social media is a place where elected officials are paying attention. So we utilize these reports and the data that comes from these reports, and we push them out on social media because it's a place where you can not only speak directly to policymakers, because policymakers are on Twitter and they're on LinkedIn and they're listening and they want to hear from you there, but they're also listening to the community and the conversations that are happening within community. And it's a place where we can amplify messages amongst one another that reverberate and can be heard in a larger sphere by policymakers. You know, that's such an interesting data point. I hadn't thought of it that way. I'd like to, you know, how do we connect on this? That kind of a thing. That reverberates and that's seen by policymakers, and it helps inform what they prioritize when they have to work through all of the competing priorities that are being presented to them. We also utilize it in blogs and opinion pieces. So while Congress is paying attention to social media, they're also paying attention to traditional media and longer forms of media. So utilizing this data to help support arguments that are being made in opinion pieces, in thought pieces, it really puts a fine point on the perspective that the American public is paying attention to what is being said and wants that information to be translated into policy outcomes. And then finally, we use it when we're directly communicating with policymakers through letters and fact sheets and resources that are designed specifically for policymakers and their staff. When we're writing letters to Congress, this data puts a fine point, like as I said, on other evidence being presented. As you can see here, this is one of our fact sheets. We're utilizing data directly from the NIH. And then right next to it, it's juxtaposed with the public opinion survey results that show the American public believes that this evidence base is something that you should be paying attention to. So that complement really hammers home the point that not only should we be coming from a place of evidence base and utilizing experts while we're making public policy, but the American public believes that that is what we should be doing as well. The American public believes that this is important and also believes that this is accurate, believes that this is information that should be paid attention to because it's coming from a trusted source. So with that, that's a little bit about our public opinion surveys. I'm going to turn it back to Ellie now to talk a little bit more about high impact advocacy and how we try to do that at Research America.
Sure. And Jaleesa, I'm going to run through this very quickly, knowing that folks' time is very precious and in case folks have questions. But there are a couple of tips and tricks for, and it really does relate to using data, using stories, and using peer-reviewed research results. You know, anything that you can bring to bear to make the case with your local, state, and federal officials that science is driving progress, progress is driving lives saved, well-being, prosperity, can help raise the profile of this issue and garner more funding and more support. So, you know, one thing you can do, not incredibly hard, it might sound intimidating, but let us help if you want. You will supply our emails and give us a call or email us. You know, you can get a meeting with your district office. So if you think of Sherrod Brown, he would kill me if he heard me saying this, but he has a district, he has an office in Columbus, he has an office in Cleveland. I think he has an office in Cincy. You know, you can get the contact information for that office on his website, which is really easy to find online. Call the office, ask if you can get a meeting with the district director. You'd like to talk about support for the National Institutes of Health, right? That's your goal. All you need to do a little bit of homework, find out how much NIH dollars are flowing into the state of Ohio. Bring that data with you. Be prepared to talk about your own work. And I know from Jaleesa how meaningful the work is that you all are doing. The power of three, this is a trick from orators over the course of time, and you'll hear politicians do this all the time. I did it earlier. Make 3 points. No more than that, or you're talking too much. Fewer than that, and for some reason, a person's brain says, wait, I need a third one. So, right? So I'm going to talk about 3 reasons why research and development isn't getting or research isn't getting the attention it deserves in the United States. And then tick those off. They can be again, they could be, the prevalence of X is growing. What if the next pandemic is more deadly than the one that we're in now? What if? 3 points. And then try to add value. Ask to be a resource. They get letters and emails from constituents. Most members of Congress are pretty fastidious in wanting to answer those emails and those letters. And they get a question about science. They don't even understand what the question is. Be there for them. Say, listen, if I can't find the answer, I'll get you the answer. And so form a relationship with that office, and you can influence policy. You can help Sherrod decide that, listen, National Institutes of Health has already been a priority for me. I'm going to pay more attention to it because it got less funding in FY24, and that's probably going to happen, you all, unfortunately, than it did in FY23. That's not okay. It's going in the wrong direction. So your voice can really make a difference. And as we've talked about, it requires good communication. It doesn't require great communication. You don't have to say to yourself, listen, I've never done public speaking in my life. I'm certainly not going to do that. Instead, say to yourself, listen, I've had to talk to somebody in the 7-Eleven. I'm going to talk to the district director in Sherrod Brown's office. It doesn't require great extroversion. I actually am an introvert. I pretend to be an extrovert, but it just requires having this desire to foster change. Work with your government affairs office at CASE and whichever universities and institutions you're from, and they can help. The other thing I'll say is I'm gonna this one I think this one's an interesting one, but we can skip this one. The other thing I'll say is that really don't underestimate the power of a letter to the editor that makes a point. It can be, listen, I don't understand why we're not making faster progress against the opioid crisis. Shouldn't this be, given the number of people we're losing a year, and I know this has been a crisis in Ohio for a very long time, why aren't we working harder? Why aren't we working together at the state and federal and local level? Whatever cause really, gives you that feeling of, I've got to do something. Write a letter to the editor. We have a template online to help walk you through it. It's like, answer this question, answer that question, you're done. You've got a letter to the editor. So think about that. And always, one thing I'll say is really try to see policymakers and their staff not as other, but as somebody who is in the same exact boat as you, who you want to get to know, and make use of the reports that you find online, Google them. I think as scientists, better than most when you're reading something that is malarkey. That's a very old term. From Ireland, so I'm relating back to St. Paddy's Day, but basically that is absolutely not true. It's misinformation or disinformation versus something that you think, that you feel is legitimate and you can get back up through fact check online. Use that data. It really is valuable. And yeah, if you can make a friend, you can make a difference. That's how Jaleesa and I got to know each other. So let me stop there and see if there are any questions for us.
So I have a question / comment. I loved at the beginning when we were talking about the survey and polling and the quote that I don't remember it word for word, but basically, if you're not getting public sentiment, you're not doing it right. We could not agree more. We're doing that kind of analogously, if you will, through our community advisory board.
Yes.
So making sure that at the beginning of your research program or study or initiative, you are soliciting for that feedback and input, because it matters. You know, you might do something that's really great and it's getting a lot of press, etc. But if you didn't have that community voice, it's kind of like, you know, well, how did you know that this was a priority? And I understand that,
Absolutely.
you know, there's no perfect way to do it. It's definitely an art, and best intentions, you know, sometimes don't always align with impact. But I just think that that is key. And if we have some people on the call who are researchers, I'd be curious to see, either in the chat or if you'd like to come off mute, how do you integrate public sentiment in your work, or how might you see yourself doing that in the future? And maybe Ellie and Sam could give some feedback from, you know, the Research America standpoint.
Say that policymakers absolutely listen, particularly if it resonates with what they have witnessed from constituents coming to talk to them. Yeah, you know, the other thing I'll say about public sentiment, surveys get mixed reviews, right? Some folks don't see them as scientific. I think you just need to be very careful too. We really try to be careful in terms of framing questions so they're not leading, and providing enough context, not trying to educate, because surveys really don't do that. That's a different animal, but enough context so that the answer actually relates to the question. And the other thing is we ask questions over and over and over again, as another way of trying to make sure that these questions, the answers are actually legitimate.
Excellent tips. Thank you. Do we have any questions or comments? So you mentioned the template for, I think, reaching out to politicians on your website. Are there any other tools or strategies that you would like to highlight?
Yeah, you know, and Sam, I'm sorry, I'm taking all the air out of the room.
No, go for it. I'm actually gonna grab the template for LTE so I can put it in the chat really
That's
quick.
great. So, you know, we have now a bunch of templates. For one thing, right now, the Ohio delegation is accepting feedback from constituents on what their priorities should be for fiscal year 25 funding appropriations, right? So there's a system in Congress where every member gets solicits feedback from their constituents, and then they submit their priorities to the appropriations committees, which write funding bills, appropriations bills, federal funding bills. So there's an opportunity right now, if on your member's website and the delegation's website, you don't see something that talks about appropriations portals, again, get in touch with us and we'll check to see if their portal is open. We have a template walking you through how to actually submit feedback. It does use National Institutes of Health as an example. If you want your member of Congress to list as one of their priorities robust funding for the National Institutes of Health, that's what this example walks you through. But you can do CDC, you can do FDA, you can do NSF. It doesn't take much. So that's another one that we have. We have op-eds, right, Sam?
We have op-eds. The second link that I put in the chat is to our general page that has all of these resources. But yes, we have tips for LinkedIn posts, tips for writing testimony, tips for going into a congressional meeting, and a bunch of other stuff there. So
thank you.
The one other thing I'd say, Jaleese, is that, you know, you may think that an email, we have a system that it's called an action alert, but basically you enter your email address. Most members of Congress only allow emails in from their constituents. So you have to enter your address information for the system to send it, to get it through to the member of Congress. You might think, okay, emails don't matter. Come on, they're getting flooded with emails. But many members of Congress, and Sherrod is one of them, at least he was one of them, meet weekly to talk about what constituents are saying and what they care about. So if there are 150 emails saying, listen, I am so not happy with the National Institutes of Health number. I know what those dollars do for the United States and for the global community. That's going to make its way to the member. It's not futile. I'm so sorry. Is there a hand? No, that was my own. I thought there was a hand raised, but it was me, my own hand.
That's a fantastic tip, and something that I can even see the CTSC implementing in some of our programming. Just as an example, we're having a Black Maternal Health Equity Summit in a couple of weeks.
Yes.
Putting that as a call to action for the, on the upwards of 400 people who will likely attend. If everyone wrote an email, I'm going to say too, like Ellie said, it would work. So
you do that. No, I mean, I think, and again, luckily, that is a big issue in Congress right now, is maternal mortality and the real disproportionate results for African-American women. It's complications from pregnancy and everything. It's awful, but I think that's great. Another thing that folks can do is, it's not always easy to find, but it should be easier. Once you have your candidates for Congress, we know the presidential pretty much, but anyway, find their Twitter handles. And listen, they are watching that feed. If you use their name in a tweet, they're going to know it. And, just to say, listen, are you going to assign a high priority to, I know prioritize is misused, assign a high priority to medical progress when you get to Congress? Are you going to actually represent your constituents' interests? They're going to get that message.
Thank you. Do we have any other closing questions or comments for Ellie and Sam? All right. If not, we appreciate your time. So many great tips, strategies, tactics. And, I was fortunate to meet Ellie at Translational Science last year and attended her presentation. Phenomenal. It's just, so many things that she just talked about. We just have to get out there and do and try. And there's power in numbers. So we're very, again, fortunate to have had your insights on this webinar, and it will be published to our YouTube channel. So if anyone didn't catch the beginning, please feel free to watch that on demand. Thank you so much for joining us.
And thanks for everything you all do in the science field. Really appreciate it.
Absolutely. It was great to be here. Thank you all so much.
All right. Have a great afternoon, everyone.